Hey everyone, this is Dr. Sirisha, and today I'm gonna tell everything about leprosy in a concise way. So, according to Ridley Joplin classification, there are five types of leprosy: TT, BT, BB, BL, LL. TT, tubercular type. It has a single anesthetic lesion, and as it goes towards the LL, that is lepromatous type, the number of lesions increases, and the lesions are ill defined when it goes towards the lepromatous type. More nerves are involved bilaterally, and split skin smear is positive. Sensations are present when it goes to lepromatous type because here the nerves are involved, and Grange zone foamy macrophages are the characteristic features of lepromatous type of leprosy. Single anesthetic lesion with granulomas are characteristic of TT tubercular type. Satellite skin lesions are hallmark of borderline tuberculoid type of leprosy, and as it goes towards the lepromatous type, the sensations will be regained. The sensations of the skin lesions will be regained, but the entire nerve trunk, that is ulnar, medial, and later radial, these nerves will be involved. Ulnar nerve palsy leading to ulnar claw-hand, medial nerve palsy, complete claw-hand, and radial nerve palsy leading to wrist drop. Granulomas are the characteristic of tubercular type of leprosy, whereas Grange zone and foamy macrophages are the characteristic feature of lepromatous type. Lepromatous type has always poor prognosis. Route of infection in leprosy is always inhalational. There is no transmission via skin to skin route. By touching, there will be no transmission. Only through inhalational route, that is through nasal droplets. And most common cranial nerve involved in leprosy is seventh cranial nerve, and most common nerve used for biopsy is radial cutaneous nerve followed by sural nerve. Earliest sensation lost is the temperature, especially the colder temperature. So we'll test the hypopigmented skin patches with a wet cotton plug, and the patient is asked whether the cold sensation is felt or not. So the temperature is the first sensation, which is lost in Hansen's disease, and the stain used is Fight for aqueous stain. Prophylaxis in contacts, and the drug of choice for prophylaxis of Hansen's disease or leprosy is rifampicin. Where do we give prophylaxis? In patients greater than 2 years, and the contacts where there is exposure or the contact period of greater than 20 hours per week for more than 3 months. So, based on the skin lesions and nerve lesions, the leprosy is divided into passibacillary type PBL and the multibacillary type MBL. Skin lesions 0 to 5 with 0 to 1 nerve involvement with split skin smear negative is seen in passibacillary type, and in both the types the treatment is multi-drug therapy. 6 months for passibacillary type and 12 months for multibacillary type. The drugs given are dapsone, rifampicin, and clofazimine. Dapsone 100 mg OD, rifampicin 600 mg under supervision once every month, and clofazimine 300 mg once every month under supervision, and 50 mg OD daily for 1 month. For 6 months in PBL and 12 months in MBL. Coming to lepra reactions, these are hypersensitivity reactions that occur while the patient is on treatment with anti-leprosy drugs. Type 1 is a type 4 hypersensitivity reaction. Type 2 lepra reaction is a type 3 hypersensitivity reaction. Just remember that the entire number will be 5. 1 plus 4, 5. 2 plus 3, 5. Yes. And then coming to treatment, NSAIDs are given in type 1. Type 1 reactions are nothing but the pre-existing lesions. There will be the pre-existing skin lesions. There will be erythema and itching and inflammation. So if there is any a little bit more erythema, itching and inflammation, NSAIDs can be given, and in more severe cases, steroids are the drug of choice. Whereas in type 2, steroids are the drug of choice, new nodular lesions will be developed, and sometimes systemic involvement is seen in type 2, um, and the clinical features of fever, arthralgia, or orchitis are also seen in type 2 reactions. So this is the program. Prevalence rate is now less than 1 per 10,000 population. It is eradicated in India now, but it is still has to be eliminated. So National Leprosy Eradication Program is now ongoing. For treating lepra reactions, clofazimine and prednisolone has to be given. Prednisolone has to be started with 40 mg and then slowly tapered.